Tom Suspenski here from Health Check Physical Therapy, and we're here today to talk about the three causes of back pain. The first cause is usually herniated discs that we see often. The second cause is a progression of that, which is degenerative discs, arthritis, or spinal stenosis. And the third cause that we see often, that's often misdiagnosed and very tricky, is a condition called SI joint dysfunction or SI joint sprains or strains. First of all, let me talk a little bit about the herniated disc. It usually occurs when someone's in their 30s or around that age, because at that age the material between each vertebrae is called the disc. And this is an example of the disc where you have a nice wide, heavily infiltrated with water space here that's more like a cartilage, and in the center of that cartilage you have a jelly mass which is like the consistency of chewing gum, but it's very hydrated, has a lot of water in it, so it takes a lot of pressure. But with repeated bending, if a person had a bad fall, or they do lifting where they go forward over and over and over again, or they twist, that changes the pressures in that disc. And what will happen over time with poor body mechanics is they'll end up having a ruptured disc, and that's what a ruptured disc looks like. This is an example of the person bending forward and rotating to the left, and it puts the pressure going to the right. With that, what people generally have is they'll have, they might have weakness, they might have numbness, they might have loss of their reflexes. Those are three dangerous signs. If you have three of those dangerous signs, it's very probable you may need a MRI. But often I tell people to come in to Health Check to have it looked at, and we'll do reflex testing, we'll do sensory testing to see if they have any numbness, and we'll see whether they've lost any strength in any of the extremities. People will complain of pain that goes down the back of the leg, and it's a very definite pattern. So if you have those problems, give us a call at our office here at 610-269-5070, and I'd be glad to take a look at you and give you some advice.